Hi, this is Abby Schnick, and I decided to do my final project on attention deficit hyperactivity disorder. So attention deficit hyperactivity disorder, or ADHD, is a common neurodevelopmental disorder in early childhood. It can have a range of effects on cognitive development as well as behavioral, emotional, and social domains of development. In order to be diagnosed with this disorder, you must meet 6 or more of the symptoms listed in the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association. Your symptoms must be present for 6 months, have been present before the age of 12, be seen in 2 or more settings, such as the home and the school, and show clear evidence of interrupting your day-to-day functions, and cannot be better explained by another disorder. There are 3 types of ADHD that people are diagnosed with. They are inattentive, hyperactivity, impulsivity, or a combination of the 2. Some symptoms of inattentive include failing to give close attention to details or make careless mistakes in schoolwork, at work, or with other activities, have trouble organizing tasks and activities, easily distracted, forgetful in daily activities, and the like. Some of hyperactivity impulsivity are fidgeting or tapping hands or squirming in the seat, unable to play or take part in leisurely activities quietly, talking excessively, talking out of turn, interrupting and intruding on others. In the combined presentation of ADHD, both symptoms of inattentive and hyperactivity impulsivity are seen in the individual. For my hypothetical case study, I chose to look at a boy about age 6. I gave him the name Ryan, and I gave him the following symptoms: fidgeting with or tapping hands or feet, or squirming in the seat, often leaving the seat in situations where remaining seated is expected, not seeming to listen when spoken to directly, interrupting or intrudes on others, trouble holding attention on tasks or play activities, and easily distracted. These behaviors happen both within the home and at school and clearly affect his academic and social functioning. Ryan is diagnosed with the 3rd type of ADHD, the combined presentation, since symptoms of both inattentive and hyperactive impulsive presentations are present. The combined and hyperactivity impulsive presentations are more commonly diagnosed in boys, and because these symptoms affect his work and behavior at school, Ryan is provided with special education services. So developmental effects. So ADHD, like most other disorders, it can have an adverse effect on the development and functioning of an individual. According to Professor T.E. Mullins, it is one of the disorders that affects cognition and has effects on human behavior and emotion. It is a disorder that really affects all aspects of a person's life. So within cognition, due to symptoms that can affect their focus in learning, they'll have difficulty learning and staying on track with the rest of the class. They may fall behind in certain subject areas or in all subject areas because of this inability. The brain at this point in children with ADHD is sometimes about 3 years behind in learning that attention holding technique. Within gross and fine motor, motor skill development may vary, and the individual may lack motor coordination necessary for skills like writing, etc. Motor control is affected, and so they have less control of their motions, and thus the fidgeting and squirming occurs. In fact, children with ADHD are about 3 years behind in learning that motor control. Speech. In some cases of ADHD, there may not be a speech disorder present, though sometimes there is along with ADHD, and their speech could fall within the normal parameters of speech development. However, even with this, or with a speech disorder, many children with ADHD will have language behavior disabilities, meaning they will have disruptive speech that interrupts the teacher or their peers, and they may speak at inappropriate times or in an inappropriate manner. So even their daily living and adaptive skills can be affected. Their behaviors and symptoms can make some daily living skills more difficult to perform, such as handwriting and dressing. And this is just because they will get distracted easily. They might not be able to focus on the task at hand. or want to perform it for the amount of time it might take. So social and emotional, children with ADHD can have a lot of issues communicating with peers and adults. They may lack social skills and knowledge for taking turns, for their volume control, and other social norms. They are often seen as disruptive and aggressive by some of their peers and may have trouble being accepted and making friends, meaning that children with ADHD are at risk of isolation even within a fully inclusive environment. So within my hypothetical case study, I've just written that Ryan has some friends in school, though he does show aggression towards his peers and often pushes his way into games and play. These behaviors make some of his peers avoid interactions with him. He does not listen very well and struggles with the social norms of speech and interaction. He often disrupts class with his speech or with his inability to sit still and keep his body controlled. So family participation. So ADHD cannot necessarily be cured, but it can be managed, and this is an important point for parents and families to remember as they become a part of this team to help their child manage their disorder in their day-to-day lives. The best way to manage ADHD, according to the Center for Disease Control, is through a careful balance of medication and therapies. There are so many specialists that can assist children with ADHD, including a range of speech and physical therapists, coaches, teachers, and more. The family and team must work together to ensure there's a consistency across these two environments, the school and the home. As a part of the team, teachers and specialists must get to know the family and their personal and cultural values. Finding out what works best for them and for the child will help you find the right treatments and therapies you can help them choose from. As for resources concerning ADHD, directing parents towards websites like chad.org, which is the national resource on ADHD, can help them find support groups, ADHD professionals, and more within their local area. So in the hypothetical case study, Ryan comes from a lower class family. His father works 2 jobs and he's not home often. His mother works a job in the morning while his younger sister is at a preschool program, and then is home with his little sister in the afternoon. So even though they're a busy family, they're trying their best to do what they can for Ryan. And Ryan's teacher will always check in with his mother after school to make sure everything is going well at home. Ryan's team works to keep his routines consistent across the school and home environment. The team tries to find the best times for his parents to meet with them and puts their scheduling first, the parents, as best as they can. And Ryan's teacher writes a note about how Ryan did each day, just a small one about his behaviors, to send home with him in his homework folder, and then can read the notes that his mother and father write back to her, keeping another line of communication open between the family and the school. So educational activities and therapies. So when you're designing activities and curriculum for children with ADHD in the classroom, these are just some important thoughts to keep in mind from the CDTC's page about ADHD. Using something like a homework folder for parent-teacher communications keeps communication open between the parents and the family, or the parents and the family with the school about the child's behaviors at home and in the classroom. Making assignments clear is also a big help. This can be done by taking the assignment apart and giving them pieces at a time in smaller steps, so they have less to focus on in that amount of time and are not just given the assignment all at once and overwhelmed. Just continuing to give positive reinforcement. You can do this through establishing like a rewards chart or just even positive words of encouragement when they do their best and show these good behaviors. And just being sensitive to self-esteem issues. I mean, every child is going to have those issues that go along with their behaviors, and just be sure to be encouraging and not to be negative about their behaviors, but instead encourage and redirect them rather than critique and correct their choices for them. So within the classroom, Ryan's teacher works with therapists within the school to help accommodate Ryan and other children with special needs in her classroom. So Ryan has a star chart during class on which she will reward him for his positive behaviors, and she does this throughout the day, and when he reaches all 5 stars for the day, he receives a sticker to put on his homework folder, so just a small reward for successfully behaving in class. So during group and circle time, she'll allow Ryan to quietly work on something silently with his hands, knowing that he's not going to be able to sit still and listen with the group. And for a lot of kids, this can show that they're still listening and participating in the group. They'll still respond with the rest of class, and they'll answer questions that the teacher will direct at the class, but it just gives them something to do during the day, and giving them that little table time is very good so that they can just stay focused while being able to distract their hands and do something. So she goes through the directions a second time with him. After she goes through them with the whole class to ensure he gets the directions, and she'll give him one step at a time rather than overwhelming him with all these steps, knowing that he probably wasn't able to listen very well the first time. And she'll provide him with helpful peers around him as well who can remind him of the steps he should be taking. And when Ryan interrupts class, she'll redirect him by saying, "My turn," instead of saying, "quiet down" or "be quiet." She'll just remind him it's her turn, that she's talking and she's instructing the class. And then when asking a question to the class, and if he answers before being called, she would acknowledge that behavior, and instead she'll call on a peer who's modeling the correct behavior, and show Ryan what she's looking for. And these are just some happenings that can occur within the classroom that are good activities to keep with Ryan and other children with ADHD that he has as a combined presentation. And just here's my quick list of references that I use throughout my presentation. Thank you very much for listening. Hope you enjoy. Have a great end of semester.